Dr.
Thanks.
Yang's comments were awesome. I think it lands very well coming from him. The don't be annoying, that's gold. Hold on to that. They spoke before about the interpersonal skills, so important. I think Dr. Yang even mentioned EQ, the emotional intelligence. And I think coming out of this session this morning, those are really key things to kind of keep in mind as you're always on your toes on a sub-I. In terms of what to look on your side, what to look for as you go out, and I think some key features that you'll see, elements that you'll see in different programs, looking at the size, the surgical volume of a residency program, and the quality of the faculty. It is an apprenticeship. It's all about repetition. So how many cases you do and with whom, that's important. What the academic resources are. How easy is it to publish, what the databases are, basic science resources, if that's what you're interested in. The culture, there's been a lot of talk about fit and compatibility, seeing how the residents get along and how they interact with the faculty. I think at our match meeting, we've kind of checked ourselves, kind of thinking about how to maintain a diverse and inclusive culture where it's not, fit can kind of mean one thing or the other, but I think ultimately it's about being a team player and knowing how to fit into a team and work with a team, especially those first 2 years are so critical. And then beyond that, but this is your family, right? It's like, 7-year marriage kind of thing. And then the other thing I'd say to look for, just by way of, kicking this off, would be what the models are for structured autonomy. Dr. Giannotta talked about the autonomy kind of running different services, how we kind of structure that in the operating room, combining autonomy with patient care. So just those are kind of 5 points that I think about right off when I talk to medical students who are interviewing in terms of kind of those key elements to kind of perceive as you look at a program.
Thank you so much, Dr. Ponce. Does anyone else, Dr. Bergschneider, do you want to go next?
Yeah, it's really hard to follow that when you stole our thunder, and it's the same points that we had. I'm sure. We all tell our students different things, and I think one thing that to really emphasize is that you're going to be spending 7 years with people. And I think this last year, I kind of felt for all the applicants that when you don't get to visit programs and really see what that culture is, not just the culture of the faculty, but the residents there, are these people that you want to be with for 7 years? Are they happy? Do they have meaningfulness in what they do? And I think increasingly important to look for is diversity. Most of us now, should have been doing this a long time ago, are really seeking to broaden that welcome mat into neurosurgery and to diversify. And back to many of the talks that were given earlier, with regard to the step 1 scores, I know UCLA and probably a lot of the other UC schools and hopefully other places are going into holistic review of applications where scores are just one part of that, but we really want to look at the whole applicant and how you can contribute, because there's so many other ways to contribute to the field of neurosurgery that are solely lacking historically, but fortunately are starting to change. Just a couple other things to add to what Dr. Ponce included in his 5 points. There are programs where there's Enfolded Fellowships that you might want to look at if that's important to you. Generally, I think they should be done in their 7th year. If you look at what the ABNS is going to allow you to do, things that you might not want to look for, if you ask me, is if you're geographically confined. A lot of places don't like that. If you say, I only want to go to this one place because I have family there or whatever, we understand that. But if you're, I think there's so many great places to train. Unless you're in a couples match or your spouse or something basically won't go with you to someplace, I think you should broaden your scope. And lastly, one place not to go to is these forums. And I don't know if the other program directors have looked at the forums. There's just complete garbage on that. It is like some gossip thing that is, I am just almost just disgusted when I look at what's written in there. Don't take your information from those forums. Kia, do you have any other thoughts you want to?
Yeah, that's great advice, Marvin. Yeah, it's hard to add much to what Dr. Ponce and Dr. Bergsnyder said. It's an interesting question what to look for in programs. I remember when I was a medical student, you just want to get into a good program, and the idea of you being selective or picky is a little bit foreign. But I think it's so important, really. As many people have said, this is 7 years of your life. It's really 7 very critical, sweet years of your life. You're going to be at a very different place in your life when you're done with this training than when you went in. So being in an environment that that's going to be positive, that's going to be supportive, that you're going to enjoy spending your time and a lot of time in. Some of your highs and lows professionally are going to occur during residency. So having faculty and colleagues that are supportive, I think is so critical. I really felt for the applicants too this year. I think that's a great point, Dr. Bergsnyder. It was tough that they couldn't actually come see your program and have dinner and drinks and go out with the residents and get a feel for what a program's like. Because I think that's always been my advice to applicants is get to know the residents, to find out if they're happy, because that's really the role you're going to be in soon. If you look at nuts and bolts of programs, the reality is that most programs are good programs. I think our society does a good job of making sure that programs, are providing residents with the resources they need for the most part. There is some flexibility in the 84 months of training. You have 30 months of elective time, so different programs are gonna structure that differently. So I think that's worth looking at. If you have a strong interest in an Enfolded Fellowship or an advanced degree. If you have certain professional development or wellness, leadership, personal development type of goals, some programs have some different emphasis and different things that can address that. So I think you can look at those subtleties, but I think at the end of the day, it really has to be a place that is going to be supported and feel good. And I think you just have to do the best you can to try to connect with residents and get a feel for what their experience is like.
You all might not know this, but 9 years ago,
I would just, sorry, I got.
The ACGME changed the way they look at residencies, and they started the next accreditation system. And prior to that, it was the wild, wild west. There were some programs, there was actually no QA on program quality, all these case minimum numbers and all that. And all you needed was a signature from the residency program director to finish. But now with these new rules and regulations that we have to meet, I think it's even the playing field. And as Kia said, almost all the programs are good because they have to meet these criteria, and the ones that don't actually lose their residency. And some of the residencies have been lost because there's actual criteria that they have to meet. There's a great question there. I'm looking at the chat whether to
add to that.
Yeah,
I would add to really look for a mentorship in the programs that you're looking at. When I started neurosurgery, mentorship was sort of a foreign idea, but when you're going someplace, if you can identify, as we heard earlier, someone that you really think that's the sort of career and where you want to be, I think that's really important, because that can lead you to what the faculty's like and what sort of people want to work there and live there. So I think the mentorship piece and making sure that there's that mentorship piece that's appropriate for you within the program is critical.
Yeah. Can't agree more.
I might add also, just in terms of, the most famous prestigious programs aren't always the best program for you. And, you don't want to, you want to be true to yourself. You don't want to try to fit a square peg into a round hole. And I think so far as like looking at not being discouraged by kind of whatever perceived tiers there may be, if you go to a renowned program that has a strong publication record, you're going to be expected to publish. And if the basic science is kind of the currency in that program, you may feel like not really that fit if you don't come in with that interest, or if you intend to kind of hang up your pipette as soon as you start residency. And so really kind of keep an open mind as you look at programs and looking for a place that you'll feel like you're resonating with, because I think you'll do better in a program like that. Because not all programs have that same emphasis on the research component when ultimately, the reps are knowing how to use a scalpel and use a microscope and putting in screws and things like that.
Someone asked a question about if programs will shift to an enfolded fellowship model, and if that's something maybe that medical students should look at when they're looking at looking at programs. Sorry, I think that programs change a lot in 7 years, so that's something maybe that they shouldn't focus so much on when they're looking at a residency program. But I'd be curious to hear what your thoughts are.
That's a great topic. I think that's something we are addressing more and more. There are many programs since the CAST system has changed to allow enfolded fellowships, with the caveat it has to happen after your chief year, meaning your chief year has to happen during a PGY 6. And there are a number of programs that have kind of adjusted to that model, allowing their residents to do their chief year as a 6 and do an enfolded fellowship as a 7. And a number of top tier programs that are offering that makes us second review our model where we have maintained the PGY 7 year, so people can do research during their clinical fellowships during their 6th year, but it's not CAST. So I think that it's kind of like you said, things changed a lot over 7 years, and I think a lot of programs adjusted to when the SNS and CAST kind of created that change. But I wouldn't put too much weight on it. I don't think it's going to ultimately change your qualifications when you graduate, your ability to land a job. But it is something new, and it's something interesting. And I think time's going to tell what direction programs go.
It's a great point. Neurosurgery residency is 7 years, and one advantage of doing it enfolded, obviously, is that it doesn't increase the number of years of training. There's disadvantages, though, that I think you do learn from other people, and going elsewhere is you benefit a lot from learning from different places do things very differently, and you learn a lot from that. The other has to do, again, and this has been brought up in terms of what is the mission of the training program, and some programs have a high emphasis on generating academic neurosurgeons where research is super important. And in those enfolded fellowships just may not be compatible with getting enough research experience to have if our goal is to graduate people who can go out and get independent funding from the NIH, it's a different model than other programs or for an applicant who is more clinically oriented. So this is part of the, buffet for you to look at when you're looking at what you want to pick for residencies. What is the flavor of that residency? What do they offer? And how much, can they do both? Or if one's not that important to you, if you're more clinically minded, then enfolded fellowships may be a high priority for you.
Someone asked about if you could please comment on the RingtoMatch communication that applicants tend to get, or from either program directors. I think sometimes even residents really reach out and tell an applicant that they're very highly regarded. Should applicants take this into account when ranking programs?
So you're saying right before the rank list is due?
Yeah, when applicants get correspondence from programs, whether it's from the or the applicant. Or
I would sort of recommend that there's a pretty good section in the National Residency Matching Program about exactly how the matching program works. I would recommend people look at that, because the reality is that the way the matching program works, if you're looking for something specific or some specific program, that matters a little bit less. If you're looking just to match someplace, then that may be a different story. And the matching program is not a specific one-to-one if you look at the way the program works.
To answer your question, I think if someone does reach out, it's usually sincere. But it's just, I think it's going to vary from program to program and vice versa. When I reach out and I hear from the applicants, I think is usually sincere, but all we can do is what we can do. And I think if there's applicants who we think will be a very good fit, it's our way to communicate with them that's how we feel. But I'm, there are rules that we have to abide by, including we can't tell them that, oh, you're our number one or number two. I've certainly never done that. And I don't think anyone else on this call has either. But I think it's a good way of transferring that information that they're a good fit.
Yeah, I think sometimes we will interview somebody and maybe they didn't realize what a good impression they made, and maybe they have not really considered the possibility of our program seriously. So that kind of initiates an exchange to kind of go deeper in terms of seeing if this might have not have been something that was on either radar that might otherwise, not have resulted in a match, but this kind of mutual interest, kind of letting that blossom a little bit. I think that's how those communications have been used in the past. But yeah, I think that adherence to the rules, there are specific rules, specific things that cannot be communicated. And I think most places comply by those.
Definitely. There's another, someone asked if they're interested in, what do you recommend for those that are interested in going into rural or general neurosurgery, if there's particular programs or things to look for?
Apply to the barrow.
I think you want a great training experience regardless of where you think your next step might take you. I also think that a lot of us evolve in residency, so I would definitely always encourage students to go into residency with an open mind. You may fall in love with academia or private practice or privatemia or some other model as you get more exposure to it. But I think in general, you really want to be in a program where you're going to get a good breadth of training, and you're going to have faculty that are experts in their subspecialty. So you have good exposure to how different subspecialties are practiced, and you feel like you're well trained and well positioned to practice, general neurosurgery when you graduate. And I think that'll do you well, whether you go into a more general type of practice that may be more rural, I guess, or if you decide to go on to an academic practice. I don't know if I would. I don't know if I would be overly strategic, other than to look at what previous graduates have done and make sure that program is a good fit. With regard to the other things that were brought up, like research expectations, requirement, and culture.
Definitely, that's a great point.
Yeah,
So,
I think that. I think the opportunity too is important. So, what's the opportunity at each place? Because if the opportunity is not there, then you really want to think about an alternative spot. So, well, what's the opportunity that's available? I mean, and I would also echo that your goals and what you do will change over the years. When I started my residency a long time ago, I had no intention of going into academic medicine because I had done my residency in a particular turbulent time during that program, and I didn't want to get involved. Of course, I spent 30 years now at UCSD in academic neurosurgery. So your idea of what you want and what you do and where you end up will change. And you want to make sure that if there's any idea that you might want to do that opportunity exists, that program you're looking at.
Definitely, that's a great point. Thank you, Dr. Taylor. One other question, kind of switching gears. Someone asked, since endovascular neurosurgery is such a growing field, could you discuss the pros and cons of taking the neurosurgical route to attain this career goal as opposed to neurology or neuroradiology residency path?
Well, you're going to have a little bit more control over patients in a way, because you're running a little bit more of a clinic, right? You can manage outpatient. It's been interesting to kind of see how this has evolved, because a lot of our endovascular teams are almost like hospitalists. Like they, in terms of, we're a private group, but they're almost like hospital employees, because they get so much volume through the ER. They get so much volume just by being on call versus elective referrals. And in that context, it's very similar. And so then it's a question of what you're going to have more fun doing, getting to that destination, operating or, doing neurology or doing radiology. So if you're going to kind of do that, on call, capturing cases that way, the destination is very similar. And a lot of endovascular neurosurgeons kind of really, they're doing shunts or something. They may not be as involved operatively. So I think it's a very personal decision, similar to somebody who may know they want to do spine and they're deciding between orthopedics or neurosurgery to get there. You can get, 3 years out of residency, you can get to the same destination. It's a question of how you get there. So I think the flexibility of kind of running an elective practice, running a clinic is really there with neurosurgery. But I think insofar as endovascular goes, you can really get to a similar destination no matter what path you take.
Great, thank you. Someone was asking if, what's a good way for students to find information on whether a program is more academic leaning or more private practice clinical focused?
I mean, the website, the program, really, tell it right up front what the focus is. So, but if they have, minimums for publications per year, that's a pretty good indication that they're academically focused, for one.
And I think mentorship also, like other prior panels have talked about, just talking to your mentors, talking to residents. It's a small community, so we all kind of know what types of programs and the culture at different programs. So I think reaching out to your mentors is really helpful. And when you're trying to figure out if a program is more academic or more clinical.
I would really recommend looking at previous graduates too. I mean, that's really where the proof and the track record is. And I think most of us post that on our website. So as Dr. Bergsnyder said, you can probably find out where the last 10 years of graduates, are, what they've gone on to do. And I think programs that have had a track record of getting people into academic type of careers or vice versa, or all of the above, is kind of proof that's a training environment that should help you get there.
Great. I think we have time for one more question. Someone asked, for applicants who might not meet the screening cutoffs for programs, how would you suggest we navigate the match process? Is it appropriate to reach out to individual programs to express interest despite less competitive USMLE scores?
I would find kind of a mid-tier program, do an away rotation and knock it out of the park. Follow all of Dr. Yang's recommendations.
This is, I guess, if I could just add, it's a little bit like applying to college, which our kids did a couple of years ago. Our kids are older than Dr. Yang's, but you need to have a hook, and that's what the deans would say at our private school, and it could be a variety of different hooks, but often you need an advocate for you. If there's someone who can make a phone call for you to say, Sheila, you gotta look at her. She's an outstanding applicant. Her scores are a little low, but there's so many great other attributes. It is the way to get in. That's the way out. It happens.
Great. That's a really great point. Does anyone have any closing remarks? I think we're almost done here, and we're gonna move on to the next panel soon.
I just want to say, I want to echo what Dr. G said, that it's so exciting to see so many students interested in this field. It is a fantastic field. I'd do it all over again if I could, but as Dr. Yang said, I think he mentioned Gabe Zada would email, and maybe Dr. G and I need his mailing address so we can write a letter to him. But it is a fantastic field, and I get all this like this on Zoom. I can't wait to see you all in person again, but I can't wait to meet you on the interview trail.
Great, thank you so much. I just want to add one last thing for medical students looking at programs. One thing I never thought I would be in California, and I think it's really, really important to keep an open mind. I'm sure everyone at USC will probably tell you that I never in a million years thought I would end up in California, and I'm so happy here. So what you may think you want in a program, what you see yourself in 10 years from now, don't 100%, exclude programs that could offer a really good opportunity otherwise. So just keep an open mind, okay?
Hey everyone, Ryan Rad here from neurosurgerytraining.org. If you like that video, subscribe and donate to keep our content available for medical students across the world.